I'm Dr. Wayne Kuang from ManVsProstate. Just got back from the Sexual Medical Society of North America's national meeting in Dallas, Texas. Special thanks to defenders Chuck Welliver and Peter Bayich for the invitation to share our ManVsProstate campaign and tie it into sex. My objective is to synergize the wisdom of academics with the community message of ManVsProstate as we prepare for change. The time is now for BPH BPO care to prioritize bladder health. With the right dialogue, the right data, we de-obstruct earlier at the right time to prevent late stage disease and be mindful of sex. My promise is that together we can affect positive change away from a prostate first approach to a data first, pro diagnostic, bladder centric paradigm so all of our patients can live their best lives with optimal intimacy and freedom from incontinence and catheters. And it starts with us recognizing who we are because late stage BPH BPO is not sexy. And for us to embark on this journey, we need to first recognize these are my disclosures that this is a conversation taking place all around the world, whether it's in North America, whether it's in South America, Asia, Africa, about a very basic truth that all that we do for BPH, BPO is really about bladder health. And to do what we need to do, we must be defenders of the detrusor, where we uphold our mandates of preserving bladder health, ending the polypharmacy epidemic, and preventing late stage disease. We profess an undeniable truth that, along with the brain, the bladder is the only other major organ that cannot be transplanted. We fight on this battlefield of male LUTs, where bladder dysfunction sits at the very center, and we fight and stand guard against the dangers of BPO, ever vigilant of the other causes of primary and secondary bladder disease, because it's always the case where there is always diagnostic uncertainty. We invite the bladder to be an equal stakeholder at the table of shared decision making 3.0. We must ensure that the preferences and values of both the patient, optimal sex, and the bladder, optimal detrusor function, are communicated and integrated into management decisions because so much is at stake. Trust the truth of trabeculation, cellules, and diverticuli as evidence of the underlying cellular damage that occurs as BPO progresses to detrusor underactivity, which can manifest in 5 different clinical scenarios that both patients and bladders experience. And it's much more than just the annoyance of slow flow, it's the anxiety of urgency, frequency, the exhaustion of nocturia, the shame of incontinence, the terror of retention, and the despair of a dying bladder. Together, these have a negative impact on health span, the number of years lived in good health, sex span, years lived with optimal sexual vitality, and we submit bladder span, years lived with optimal detrusor function, because bladder health supports our freedom to thrive and become the best version of ourselves. Before we explore sex and bladders, what we do need to do is create a linguistic framework within which we can talk about bladder span. Thus, the ManVsProstate 5 stages of bladder health, a community based, patient facing decision making aid, because BPH BPO is about bladder health. The bladder is not transplantable, so let's take care of it. Like the heart is a muscle that pumps blood, the bladder is a muscle that pumps urine through that prostate that starts off about the size of a golf ball in the shape of a donut. And as that prostate grows bigger, that donut hole grows tighter, causing things to slow down, stage 1. That bladder muscle now has to work harder, 5 years, 10 years, 15 years. It begins to struggle, quiver, causing overactive bladder, stage 2. If we don't take care of it, the bladder can act out like a rebellious child, contract without permission, causing stage 3 urgency incontinence. If we really don't take care of things, like the heart can have a heart attack, the bladder can suddenly stop working, causing the emergency of retention stage 4. And like the heart can go into heart failure, the bladder can go into bladder failure, causing a lifetime of catheters. Worst case scenario, the heart can still be transplanted. The bladder does not have this option. Yes, this is an oversimplification. Transitions are not distinct. Stages can be skipped and stages can coexist. With that said, this highlights how this disease process steadily progresses to more serious stages and how our top priority is to prevent patients from needlessly entering late stage disease. As we have seen in the Thomas study in 2005, where the decision was made to simply observe. These 141 men with obstruction on multi-channel, some observed out to 24 years. The consequences were far more than just a decrease in flow and a decrease in contractility. The real ramifications were on bladder span. Stage 2 detrusor overactivity increased by 100%. Stage 3 urgency incontinence increased by 50%. And 7 men were progressed to stage 4 retention when there were none at the start. To stop this assault on bladders, we must be preventative interventionalists, intervening at the right time before the onset of damage or before the damage is irreparable. This starts with shared decision making using symptom scores. One size doesn't fit all. Find what works for you. There's the IPSS, single page, the LEARN, nice question on urgency incontinence, the ICIQ, nice question on retention, and those for sex. Please use academic, validated questionnaires based on symptoms. In support of academics, ManVsProstate launched a communication tool based on Bladder Health, the International Bladder Prostate Symptom Score. Single page designed for community urologists. Bladder is in the title to ensure that its preferences and values are considered. The IPSS and quality of life questions were kept and left 100% the same, but simply reordered to mirror voiding subscore stage 1 BPO, storage subscore stage 2 OAB. The symptom score, the total score for the IBPSS is identical to the IPSS for continued comparative academic research. 2 questions were added based on the LEARN for stage 3 urgency incontinence. Have you ever leaked urine or wet a pad after feeling the sudden need to urinate? Based on the ICIQ for stage 4 retention, have you ever been unable to urinate and needed a catheter to drain your bladder? This vertical sequential layout mirrors the horizontal stages, empowering patients to diagnose themselves and pinpoint exactly where they are now in the present and where they could end up in the future, igniting them to take action about bladder health. We squeezed in one more question to spark a dialogue about sex, a topic that's too taboo for too many men. In the last month, have you had ejaculation and or erection problems? Now translated into more than 12 languages, from Chinese to French, German, Spanish, Portuguese, Urdu, Pashto, now Korean and Malay. The IBPSS prompts us to explore existing research for a correlation between sex and stage. The ICS BPH study, a classic. 1,200 men over 12 countries. Yes, LUTS is associated with sexual dysfunction. And looking at the odds ratios, they were especially elevated for storage symptoms and incontinence, hinting at a negative correlation between stage and sex. Small sample size, we march on. To the classic Rosen study, yes. 12,000 men, academic IPSS. It solidified how LUTS is associated with sexual decline as men age. Yet it kind of lacked the clarity and granularity that we needed. Wouldn't it be nice if there was a study that could blend the best parts of both of these studies? And there is the EpiLUT study. The European, Nordic, North American Brigade came together and then divided 6,000 men into 3 groups, roughly estimating our stages. Early stage with no or minimal symptoms, stage 2 continent OAB, stage 3 incontinent OAB, and confirmed what we suspected about sex. As men progress from early stage to stage 2 overactive bladder up into stage 3 urgency incontinence, sex gets worse. Premature ejaculation increased by almost 50%. Ejaculatory dysfunction more than doubled. Mild ED increased by 100%. 1/3 of men enjoy sex less as sex progressively declines, so that only half of the men are still active by stage 3 urgency incontinence. These data support a negative correlation between sexual performance and stage. While this retrospective mapping of historical data is helpful and insightful, more research is needed for confirmation of these observations, as well as we expect more men to have less sex as they enter into stage 4 and 5. Because catheters are not sexy. These one-point restraints are a hindrance, and taping it down and stuffing it into a condom is not a solution. So we must be better and do better by our men. And as we rise to that task, know that ManVsProstate stands with you with free access to our ebook, the IBPSS, educational patient videos. Dive deeper with LinkedIn, our book, and recent review. To conclude, as BPH BPO progresses, sexual performance worsens. Let us be the change that we seek. With the right dialogue, the right data, we deobstruct at the right time to preserve bladder health and optimize sex, extending bladder span and sex span. Make our vision a reality of all of our patients living their best lives, incontinence-free, catheter-free, with a level of intimacy that they desire. Lean into protecting bladders. We are defenders of the detrusor and saviors of sex. And let's go save more bladders. This concludes what I have to say and share with you today. I just want to say that sharing this time with you is hopeful, and I look forward to similar interactions frequently in the future. Take care.